Hi, everybody. Welcome back to another episode of the Mama Project podcast. Today, I have a special guest for us, and this is a very hot topic with moms nowadays is starting solids and how to get my baby to not be picky, and should I start purees or should I start, straight to finger foods? What should I do? So I have Edwena Kennedy here from My Little Eater. Edwena, thank you so much for being here.
Thank you so much for having me.
So tell us a little bit about how you got here, like how you got to this point in really specializing in starting salads and what your journey's been like.
Sure. So I started off a mom of two boys, and I was in my nutrition program, my dietetics program in university. And I was, feeling really good. My boys were really young at the time, somewhere around like maybe 3 and 1. And, I thought I had a handle on everything. They were eating well, the whole first year of life was great for both of them. And then, I felt like into toddlerhood, especially for my second one transitioning to toddlerhood, he was doing really good. My older one was doing good. So I thought, I knew what I was doing. Well, once they hit further into toddlerhood, so somewhere around 2 and 4, all of a sudden overnight, I felt like they just turned totally picky. They only wanted chicken fingers, fries, hot dogs. And it wasn't even like I was offering it that much, but it was like they tasted it and that's all they wanted. And it was so hard to figure out what to do. And it even like created a lot of arguments between my husband and I with like, what should we do? He was like, well, you have to give them kids food. Of course, they're not going to like adult food. That makes sense. And I was like, no, that can't be right. But yet I was feeling so embarrassed because I'm like, well, I'm studying this stuff and I took a course on child nutrition and I never learned what to do. Like I learned everything about how much iron they needed and how much fiber and protein they needed, but I had no idea how to actually get it into them. And so that was when I really started deep diving into the research, trying to find content like courses or anything I could find online. And at this time, Instagram wasn't what it is today. We didn't have a million different parent experts out there giving information so readily and so freely. So it was really hard. And then when I did find info, it was so confusing. It was either really scientific mumbo jumbo, and I could not translate that to real life, step by step examples. And what do I do in what order? And how do I, make this nuanced for my kid? And then the other thing is, if I did find info that was a little simpler, it was so contradicting. Some people would say this, some people would say that. So, what I started doing was taking the research, started to implement and create a plan that I used with my kids. And then I started using with all of my one on one counseling clients. And over a period of about 3 or 4 years, I got such a great kind of step by step plan in place that worked for my kids, worked for the clients I worked with, and just saw crazy transformations. And one of the biggest factors that I really started picking up on was this starts early. This starts well before toddlerhood. What we do in babyhood is actually critical, especially the period between 6 and 9 months of age. And it's not to say you can't change things or do extra things or improve things later on, but it makes it so much easier because 6 to 9 months of age is that period where they have more of an affinity to learn how to like different types of foods and also to learn how to chew and use their oral motor skills to be able to handle certain types of foods and textures and things like that. So that's sort of how it all started. And I created two online courses out of those, the baby led feeding course and then the feeding toddlers course.
Yeah, I love it. So, how did you, with your boys, since they were 1 and 3, how did you kind of like take two steps backwards to go forwards? Like how did you do that with them?
Yeah. So one of the first things that I did was, I mean, it was a lot of trial and error, but the first thing that sort of clicked was implementing family style meals. And so it was really simple concept. Basically, instead of pre-plating their food, I would put all of the different components of a food out on the table and then pass the dishes around. And even though they couldn't scoop it themselves, I would ask them, do you want a little of this or a little or a lot of this, or pretending to help me and just getting them more engaged. And that was something that I noticed was working. And it led me down the path again to to understand that the less pressure, the more independence I gave them, the better. So that's sort of how I started honing in on which strategies to try. And then again, developed sort of an hierarchy for once we get this, we reduce stress first, we create some independence, we develop a love for kind of a curiosity, I should say, around food. Then you can start implementing all these other strategies that will work once you've got those foundations in place. So it was a bit of a, like I said, trial and error until I understood the real patterns and like kind of psychology around how kids' minds work.
Yeah, that's so good. So let's get down to the nitty gritty. So talk to us first before we get into like starting solids and all of that. Talk to us a little bit about some of the myths about starting solids. Like the rice cereal in the baby bottles was big for the baby boomer generation. Purees at 4 or 5 months old. So talk to us a little bit about some of those.
Yeah, I mean, there's so many. I definitely think one of the best ones to start with is the age at which you should start solids, because I think it's probably the first question that comes up for any parent, right? So, traditionally, and so I'm talking even currently, actually, there is a lot of literature out there, tons of pediatricians still saying start solids at around 4 months of age. And essentially, there's no real checklist that happens at 4 months besides, hey, is your baby interested? Great, you can start offering them as long as they don't have any serious medical issue. They're like, go for it. But what we've really learned over the years is that babies at that age still don't have a really adapt and like mature digestive system. So that's one. We know that babies who've been introduced to solids really early, especially lots of variety. Like, so it's not just carbohydrates, there's a lot of proteins and there's fibers and vegetables and that kind of thing. It can be hard on the digestive system. And then also we know that even the World Health Organization is very strict, or I shouldn't say strict, but very clear on the fact that nutritionally all a baby needs until 6 months of age is breast milk or formula. So there's no nutritional need to have to introduce solids earlier. There's myths out there like if your baby's bigger, they weigh more, they might need solids earlier. Or if your baby's underweight, let's add some solids to their diet and that's going to help them grow. But really, at the end of the day, your baby's stomach and their appetite is what it is. So all you're doing is really just displacing the breast milk or formula, which is complete. It has every nutrient that your baby needs and in the right proportions. And it's easier for your baby to actually get that in. It's easier to swallow and consume liquids over solids. So you're actually just displacing it with solids, unless what most people do is force feed, or especially if you're concerned about your child being underweight, there's a little bit of pushing, a little bit of pressure. And so now you're teaching your child to override their hunger and fullness cues. And again, that's kind of a habit we don't want to encourage. So overall, waiting until 6 months is this kind of the best recommendation. And that's whether you're starting with purees or if you're starting with finger foods. And we can talk about some of those signs and why it's okay to, or why you should wait, or what I should say, what sign to look for at that age that would indicate either are safe. Rice cereal, like you said, that's another one that, many parents, and I understand why they think, my mom introduced me to solids with rice cereal. The pamphlets that are at my doctor's office say rice cereal's probably the best food. And it's because it's iron fortified. We know iron's super important for baby nutrition. But we also know that iron is found in a lot of different foods. And we also know that variety, thankfully, again, to the newest research, having a variety of flavors and a variety of textures is so important at this age. So that's not to say rice cereal is not okay, but it is to say that we don't want to have it as a daily option. We don't want it to have, to be the food that's offered for weeks or months on end. You can offer it in and amongst other types of foods. And the other reason for that is because rice is a crop that absorbs a lot of arsenic. So in the soil, just naturally, rice, sweet potato, carrots, those are kind of crops that tend to absorb a bit more arsenic in their growth process. Again, not trying to scare anyone or say that never eat rice, never eat sweet potatoes. Totally opposite. Eat them, they're incredibly nutritious. However, because babies' bodies are so small, they weigh so little, per kilogram or per gram of their body weight, you can get a lot of arsenic buildup because they're only consuming rice cereal. If they're having it daily or they're having it a few times a day, and over a few weeks to a couple months, that's going to build up, and we don't want to risk any type of arsenic toxicity. So again, variety is just kind of the best way to stay healthiest and also to develop those feeding skills that we want them to develop early on.
So how do you know that a baby is ready to start solids? Like, what are some of the developmental signs?
Yeah. Okay. So let's kind of start with the earliest ones that emerge. That's going to be typically head and neck control. That happens as early as 4 months of age. Again, a lot of parents will say, hey, look, my baby can now turn their head or hold it still. That must mean I can, introduce solids. But what we really want to see is core support, really good, strong core support, and the ability for them to not just have head and neck support, but hold their torso upright, and kind of sit in an independent seating position for an extended amount of time. There's no minimum test, that you have to kind of go through. They have to sit for a minute or anything like that. But generally speaking, you want them to be able to sit in a high chair, not slouch, keep their airway nice and open. That's going to keep all swallowing safe, whether it's purees or finger foods safe, and they can clear their throat, they can cough it back up, they can gag it up if needed, right? And that's going to keep them safe. And then also they can actually not get tired, right? So they're sitting there, they're not reclined because they get so tired they have to recline or tilt to the side. So all of that keeps feeding safe and also effective. The other thing is showing interest in food. Of course, that's something that happens as early as 4 months of age. Not the sign that you want to look for exclusively. It's one of many signs that you can look for. So I like to think of that as a pre-step. Okay, great. Now that your baby's interested, let's use that to model eating, bring them to the table, have them watch you, have them look at you chew. But again, from a digestive and nutritional perspective and a safety perspective, we don't want to necessarily introduce the food at that point. Um, the ability to bring large objects to their, sorry, can this be edited? Like just quick. There's
Yeah,
someone at
yeah,
the door
yeah.
and now my dog is
No,
barking.
that's
I'm just
okay.
gonna, okay, I'll be
Oh,
back.
go for it. You're good. You're good.
No problem. I'm just doing an interview, so I'm gonna just get back in. Colby, come here. Sorry.
That's okay. Don't worry about it.
Okay, so the other sign that you want to look for is that they are able to bring large objects to their mouth with precision. So that's going to allow them, obviously, to pick up food or pick up the spoon and consume it. So the idea is, as much as you can, when you're going through the solids process, your baby is doing a lot of the work. Your baby is a participant, not just a passive kind of member of the, or passive, you know being, I guess, at the table. They're actually participating, they're active, and they can only do that when they can grab something and bring it to their mouth. And again, they can do that while leaning forward, so they can reach over to that high chair tray, to the corner of it or to the middle of it, and they can still keep that core support nice and strong and their airway open to be able to safely consume food.
So, what is the difference between baby led weaning and what you talk about, which is baby led feeding?
Okay, very good question. So, baby led weaning, for anyone who doesn't know, it's essentially, it came as like a counteractive movement from puree feeding method, of starting solids, which is essentially, it's very parent led. So, parent is feeding their baby with a spoon, purees on the spoon. And again, baby's very passive, and it's often been like majority of cases is babies stay on purees for way too long. They're on purees at 9 months, 10 months, 11 months of age. And then solids aren't really taken seriously in terms of texture and finger foods until closer to, like I said, 10 to even 1 year of age. Baby led weaning, when that came around, that was to totally, counteract it and say, hey, listen, babies are ready to eat finger foods at this point. They can actually feed themselves. We can give them larger, softer pieces of food that they can hold and gnaw on it and take bites and swallow. And they're going to develop and use these amazing oral motor skills that is very natural for them. And so we don't need to be feeding them purees. We don't need to be feeding them, period. So, what I have come to learn through my experience as a mom and as a feeding expert is that online and in texts and everything like that, it's extremely black and white and very opposing. These two methods have always been almost at war. Like parents that are proponents of one versus another, are always saying, well, this is the right way to do it, not the other way. This is going to harm your baby if you do it this way. So it's like been very judgy, it's been very black and white. And so when I kind of came into all of this, I kept thinking, why are we so divided on this? Why can't we actually look at what the research says and basically take what you feel you're ready to do? So if you feel comfortable with purees, start there. If you feel comfortable with finger food, start there. And what we actually just want to do is progress your baby according to their cues, their sense of independence, and how and I guess just the skills that they're developing. So that way it keeps it, you're part of the feeding equation. We're going to take your anxiety levels into consideration. We're going to take your feeding experience into consideration. And we're also going to look at your baby and say, hey, look, some babies are perfectly adapted to start chewing and they love holding big food, big pieces of food and taking bites into it. Other babies don't know what to do. They need a little bit of encouragement. That doesn't mean we're not going to start solids with them. Some babies gag like crazy on simple textures, while other babies may gag a little bit, but they're not, unable to finish a meal. So we have to work with the individual situation of you and your child. And so that's kind of where this baby led feeding method came from. So it's start where you and your baby are ready and progress them in a timely manner so that you're not never getting stuck on super easy textures and then delaying the advancement of skills. And then also you don't have to feel rushed or pressured. So we created a tool called the texture timeline. And it's our signature tool that basically walks you through different phases of textures. We have phase 0, phase 1, phase 2, and phase 3. And it goes from easier to more advanced. And it covers both puree options and finger food options at each phase. Because again, it does not matter what you're doing as long as it's baby led, your baby is participating, and you are progressing them based on what they're showing you they can do. So if they're handling a texture well, we say, awesome, now you can move them up to the next phase. Ease yourself into that, feel a little comfortable. And then when they master that and when you feel good, move them on to the next phase. And we do give kind of general timelines to hang out in each phase, and they're pretty short. The very first phase is 0 to 5 days. Honestly, it's very short because it's thin puree. So think of the texture of applesauce or really runny, again, rice cereal. It's great. You offer it to your baby. They are only really using a swallowing motion. It's the same motion as they would use if they were drinking breast milk or formula. But they're kind of getting used to the idea that a spoon's in their mouth. I swallow it. Ooh, there's a flavor there. Ooh, this is what meal times are like. Once you feel like they've got a hang of that, which really shouldn't take more than about a week, then you can gently move them on. So you're doing these little nudges so that they don't get stuck and you don't get stuck there. Of course, they're just suggestions. You don't have to stick to exactly that timeline, but they're just guidelines so that you can be aware of, maybe I should advance this a little bit more, especially if I'm anxious, give myself a little bit of a push.
Yeah, absolutely. So how would you recommend parents choose between purees and finger foods and what to do if they're struggling to decide?
Honestly, I think first kind of look at yourself and just kind of determine, am I a really anxious person? Have I had any experiences with choking in the past myself, or my baby choking on anything, or does my baby have any kind of tongue tie or some kind of oral obstruction or medical issue that I have to take into consideration? Generally speaking, though, all babies, if they're term babies and healthy, no medical issues, they can start either way. So if you're feeling, I mean, it's normal to have a little bit of nerves, but I like to kind of say start your first week of meals with a bit of puree and a finger food, on the tray right away. And you can see what you feel comfortable with when your baby's picking that up or putting that in their mouth, but also what's your baby interested in? Some babies love that spoon, especially if you've been priming them to hold a spoon and, teethe on a spoon from 4 to 5 months of age, and they love that idea. They might gravitate towards that so much better than the finger food. Doesn't mean we're not going to offer the finger food because you never know what meal they're going to decide, hey, this looks interesting to me now. So we still give them that opportunity. But it's there's the other side there. There's the other option there so that they're still getting a little bit of iron in or they're still getting that flavor exposure in. Um, so it's kind of, it's really up to the parent. If you feel like I feel like I can dive into every food. I can go into phase 3 foods on that texture timeline. I know they're all safe, but yeah, they're a little bit more advanced. That's fine. Go for it. Let your baby learn. In fact, they are so primed to be able to handle. It's like almost like they won't ever learn what to do until you give them that texture, but they can do it as early as 6 months of age. So, it's amazing to see like a baby who is eating, chicken strips or like shredded pieces of chicken that's been slow cooked even within the first couple days of starting solids. Like it's absolutely amazing what they can do. It's never perfect, but it's definitely super productive and they can learn so quickly just how to manage those textures. So really it just depends on your comfort level, excuse me, and then your baby's interests and skills.
How do parents know that their baby is ready for the next texture phase? And then like, what should they watch for in terms of like red flags that they're not ready for the next phase?
Okay, awesome question. So, when you're offering your baby any texture, you kind of want to look for, I mean, it's very simple. At the end of the day, you want to just make sure that they can hold that food in their mouth. So, if your baby is not even spitting it out deliberately, but it's almost like an unintentional food just falls out of their mouth. They don't even understand how to close their mouth around that. They don't know how to even move their tongue around something. Like it's very like it's almost just like it's like a flaccid kind of look. That is something that would say, okay, look, they need a little bit more time. I'm not going to move them onto something more advanced. Let them practice a little bit more there. If they can swallow the texture without difficulty, so meaning there's no excessive coughing, there's obviously no choking incidents, and there's no excessive gagging. So gagging is very normal. It's something I expect at almost every meal, but I expect it to be 1 to 4 to 5 times in a meal. I don't expect a baby to be frozen by gagging experiences and being unable to continue a meal, getting really anxious or distraught by gagging. That would indicate, okay, either there's something wrong, maybe again, functionally, maybe we need to check do they have any kind of oral obstruction? Do they have a sensory issues or something bigger going on? If this is happening for a couple months and they're really not getting past this gagging, or it's just likely just, hey, we just need to give them some more practice, some more time. So if you're on a phase 1 texture and they are gagging excessively, keep them on that phase 1 texture. Again, usually within a week of consistently offering it, they get over that. And it's very normal, very expected for that to happen. But um yeah, but if you feel like, it's only a few times a meal, they're still happy, they recover well, you can go ahead and move them on to other phases. So that's yeah. So those are the main things to look for.
And then how do you serve finger foods in a way that keeps them safe for baby? Are there any typical rules of thumbs? And I know that this because I went through both of her courses, and so I know the answer to this, but and like I guess how that changes from, 6 to 12 months, how you serve
Yeah.
finger foods.
Yeah. So I guess the most general rule to think about is when your baby's first starting. So let's say 6 to 8 months of age, bigger pieces of food are actually safer and they're easier to hold. Okay. So the reason why I say that is because in the beginning, your baby only has palm or grasp, which basically is like the ability for them to wrap their thumb and their palm and their fingers all at once around a food. So if you have a small piece of food, clearly they can't pick that up. So bigger pieces are going to be easier for them. They're also sort of safer. And of course, it's not like every single case is like this, but on the whole, if you think about putting something larger in your mouth and also soft, I didn't mention that, but squishable between your thumb and forefinger. So if it's a nice soft texture that's larger, it is easier for your baby to be able to track that in their mouth, figure out where that piece is. So even if they take a bite, or pull a piece off, okay, that's a large piece, and you can picture it in your own mouth. If you took a bite of something and you have a large piece, you can much more easily spit that out or just locate it to move it to the side or to the front or to the back than it would be, let's say, to have these little tiny pieces, even if it's soft, but these little multiple pieces of food that spread out over your tongue. It's a quite a skill to be able to gather those pieces into one bolus or one sort of like object in a way, and then either swallow it or spit those all out, right? So I like to go again. The rules would be soft and squishable between your thumb and forefinger. So we have that squish test that would really indicate if it passes. Like if you can squish it between your thumb and forefinger, your baby's gums are so much stronger than that. It's a very good indicator that it's safe. And then again, go bigger if you can, um, as a general rule. There's going to be some nuances. There's going to be some foods that are a little bit more slippery, right? That might break off in slightly harder or irregular shapes. So certain things like maybe oranges or melons, like even when they're ripe, they're never that ripe unless they're bad, that that I would say go for huge pieces. Okay, in that situation, we have it all outlined in our course video showing you, okay, let's say at this phase, you can slice that melon super thin, paper thin. You can almost see through it. And it's this long shape so they can still grab it, but it's going to almost melt in your baby's mouth a little bit more. Or if they were to choke, God forbid, if it was to slip back and they did not catch that with their gag, then this is the likelihood that it will dissolve or that they could cough it out is going to be higher than another way. So again, the course, we have a texture timeline library, it's called. So it will outline, you could search a food and it will show you, how do I serve this at a phase 0, phase 1, phase 2, or phase 3? And it will give you options for bigger versions, smaller versions, and just kind of take the guesswork out of it.
Yeah, I love that. And that really helped me, when we had a family meal and I'm like, okay, how do I make this for her? And it really, really helped. So talk a little bit about the gag reflex and like when it's at its prime and like when should parents kind of like stop hearing it as much, or when do you feel like babies kind of get used to the foods, they have stronger chewing skills, when should parents realize that it goes away, as they gain more practice?
Yeah. So when you think about, again, the most normal thing for a baby at around 6 months of age is you actually see a very active gag reflex, and that's a great thing. That is an indicator that your baby can put foods in their mouth or put objects in their mouth because they've got that active gag reflex firing away that keeps the food closer to the front of their mouth or out of their mouth versus back, right? Like where the airway is. So if you kind of change your perspective around why the gag reflex is there and how it is important, it helps reduce a lot of the anxiety because I think for most adults, we kind of think, oh my gosh, gagging is bad. That means they're choking. This looks dangerous. It looks so uncomfortable. But for babies, again, that is like a reflex, like any other reflex that is there. So thinking about at 4 months of age, they have a tongue thrust reflex, right? So that's like literally their tongue. If you put something up to their mouth, their tongue should be shooting out of their mouth, which is actually there to prevent things from going in, which is another reason you kind of think about it. It makes sense. Oh, why don't we need to be introducing solids at that age? Well, they've still got an active tongue thrust reflex, right? So their body's literally saying, I don't need things in my mouth. But now at 6 months, I can put things in my mouth and I'm going to be able to gag pretty frequently, which is a great thing because it keeps me safe and it keeps me almost allowing me to reposition that food so I could maybe munch on it, maybe spit it, maybe mash it with my tongue and try these different things safely. So, in the beginning, your baby's gag reflex is extra sensitive. So, it's going to activate likely when food or an object kind of hits like the top or the front third of the mouth. As they continue to mouth objects and put foods in their mouth and get longer objects and push them further back and gag on them safely, obviously, then the gag reflex is going to start to diminish little by little until it hits the back of the throat. And that usually takes a few months. So it's usually by around 9 to 10 months of age, your baby can handle pretty much everything. The gag reflex is just as good as it is or as diminished as it is in adulthood for most adults. And again, that's because their body is saying, hey, it's safe now. I trust you. You know what to do. I don't have to be activating constantly, right? You know how to move your tongue, you know how to swallow, you know how to mash that, bring it over to the side of the mouth and mash it enough times. So I can chill, basically. So that's kind of what you're going to want to see is a lot of gagging. And then you give them practice with foods, and then it starts to diminish. One of the most common myths or mistakes I see is that parents will think, oh my God, if they're gagging a lot, I need to wait till they're older so that the gag reflex isn't as active, then I'll start giving them the more difficult foods. But what that's actually doing is putting them in a more dangerous situation because now they're learning how to eat these more challenging textures and shapes and sizes without having that safety mechanism as a backup. So I'm not saying gagging won't happen, but it's less frequent or it's less strong. And then for other babies, they develop an aversion because they didn't get that exposure earlier on. So now they have a sensory aversion on top of all of the safety part, and they just start gagging out of disgust. So, I do like to say just work with it. It's there for a reason, and know that it's a great thing to see actually when your baby's starting solids. Try and stay calm, try and stay really positive, and notice how your baby recovers happily. Right? It's when we stress out or have this big grand reaction that they start to learn, oh, maybe that was not a good thing to do. Maybe gagging's bad, and then they can start to develop a negative kind of experience around gagging.
Well, and then a lot of things I think I've seen too is like, oh, my baby must not like that food,
Mm.
right? Like if they're gagging or if they spit it out or something like that. Talk about that because they don't know any better, right? And instead of just not offering it, you keep offering it, right?
100%. Yeah. So that's exactly right. Often the gag is looked at as a sign of disgust, which it could be. I'm not going to say it's not always, but it also could be again because, hey, my body just doesn't know what to do. Let me reposition this. So, what I like to say is, doesn't really matter what the reason is. What we actually want to do in both of those cases is continue to offer it over and over and over because again, back to what I said earlier, between 6 to 9 months of age, your baby's body is primed to learn what foods are safe, how to manage textures, what flavors taste like, and how do I like them. And there's a lot of awesome research actually that shows that, I mean, it's from an evolutionary perspective. Again, kids look to their parents, and whatever foods they're eating and whatever foods they're offering, this is the time where they build up that knowledge and that brain kind of mapping and path awareness that says, oh, these are the foods I can eat and should learn to eat. So if we don't offer them, so let's say they gag, maybe they make a funny face, and we're like, oh God, they don't like that. Or maybe I offered it once or twice and then they did that. Okay, I've tried enough times. I'm going to just offer it a different food or modify it to a way that I know they will eat easily. Well, what you're doing is just telling them, hey, I'm going to prime your palate to only like food this way. So we often sweeten things. We often might soften things. Maybe we cut things in a certain way outside of safety issues, but more just because they prefer it. Well, you're just kind of telling them, hey, learn to like it this way, learn to only eat these flavors. Whereas we want the opposite. We want them to experience the bitter, the sour, the savory, the spices like the curries and the Thai, like any different kind of flavors that you can throw it in. And the most, I think, comforting thing to think about when you're going through this process and your baby might refuse it, that's okay. It's normal because they're learning. Think about the fact that at this point, they don't need calories from solids yet. So this is the learning phase. This is the time to let them, hey, it's okay if you don't want to eat. No big deal. We've got milk coming up in 40 minutes. So you can actually feel okay with them not eating a ton, but knowing I got that exposure in and it's been a positive exposure and I'm building that palate up versus waiting until again later into closer to toddlerhood or even closer to 1 year of age where they're going to have a reliance. They actually truly do need the calories more from solids. And now it's going to be so much harder for them to refuse a meal because now you're stressed and they're not getting anything in. So
Hmm. What about parents introducing more than one food at a time? Can they at the beginning, or do you recommend just like one food a day up until, I don't know, 8 months and then more? And then when do you want them ideally eating? two to three balanced meals a day.
Okay. So it is, again, commonly found in the literature that you would introduce a food, any food that you're introducing, basically introduce it for a couple days, maybe even up to 5 days in a row. Make sure there's no allergic reaction, and then move on to a new food. There's been a lot of pushback against this amongst tons of health professionals because there is no research to back this up. It's basically an old wives' tale, kind of an old tradition based out of fear. Again, that, well, maybe your baby's allergic, you need to be able to track which food it was. What we know is that if an allergic reaction is going to happen, it happens almost 90% of the time, 95% of the time within the first 2 hours of consuming the food. And if you want to be extra safe, you could introduce that food the second day. This is what we do for true allergenic foods, or I should say, top allergens. You introduce it a second day. And if there's going to be a reaction, it's generally bigger that second time. So within the first 2 hours, you'll see something happen. If you don't, then you can move on. Personally, I say if it's not a top allergen, go ahead and introduce any in whatever order, and you can mix, you can add more than one. Because, first of all, the chances that your child's going to be allergic to chicken or rice, is extremely slim, extremely slim. So, the benefit of introducing the variety and increasing kind of the number of foods that they've been exposed to, again, from 6 to 9 months, much more outweighs, like the benefit outweighs the, I guess, potential benefit of knowing were they allergic to rice or not. You know what I mean? Um, because again, that's what the research shows is very clearly the more foods they've been introduced, the more flavors and the more textures, the better. So if you were to do the pace of, let's say, 3 days, one food every 3 days, or food every 3 to 5 days, you're probably getting to maybe like 30 foods by 1 year of age, right? Whereas we have a baby led feeding meal plan, we actually get to 115 foods in the first 60 days. And it still takes into account allergens. We still have a protocol for that. The top allergens are treated differently, but they're a total of 10. So you get through those 10 foods with a specific protocol, but the rest of them, there's really no need to live in fear and really slow down progress because of a minor, small, teeny tiny chance of being allergic to chicken.
How do they introduce the allergenic foods?
So, when you introduce an allergen, kind of the first thing you want to do is first start early during the day, start early in the day. So, if you're typically offering solids, let's say in the evening or at lunch, try and do a morning feeding. Just because if something is going to happen again, you want to be able to catch it and you want to be able to see the development of any signs or symptoms. So, the more serious reactions, like I said, happen within the first 2 hours. After that, you might see some digestive upset, maybe diarrhea, maybe a rash started developing within those first 2 hours. It's not hives, but it's a little bit of eczema or a little bit of hives. Sorry, yeah, eczema or hives, but mild, I should say. And you want to just watch that develop and be aware. So you don't want to do it in the evening when they're going to bed and you can't see what's happening. So that's the first thing. When you're introducing it, you want to start small. So I like to do, for peanut butter, we have a specific protocol of about an eighth of a teaspoon, watered down, like thinned down, so that it's not a big glob and it will cause, it could be a choking hazard. So you just start small, you wait 10 minutes. And then if nothing develops within that meal, within those 10 minutes, then you can offer more. So that's just going to help ensure in case there's a reaction and in case they're severely allergic, they only have a small amount in their body versus a big amount. Um, and you're going to want to reintroduce that allergen again for a second time the next day. So again, in the meal plan, we give you that protocol. Day one, let's say you're introducing cow's milk. We have a recipe that introduces the cow's milk, well. And then the second day, we reintroduce it, maybe with a slight modification. So they're getting some new flavors from a non allergenic food, but then we have that allergen reintroduced the second time. The second time, I will say, you don't have to do that whole 10-minute wait, right? Because we're going to assume, okay, they weren't that severely allergic to it the first time. So we're probably safe to just let them eat freely. But again, if a reaction is going to happen, it typically will happen on the second exposure, just because the body has the antibodies developed now. So they got exposure to the allergen protein. Their body says, okay, we don't like this. Let's develop some antibodies. So the next time it gets introduced, it's like recognized quicker and faster. So that's why we do it 2 days, just to 100% rule out an allergen.
Awesome. And then, so what about baby nutrition? Like, we know the first year of life that breast milk or formula is like the main source of food nutrition. So, and I've heard of this before, that like food before one is just for fun. So
Mm.
talk to us. I know you love that one too. So but honestly though, if you think about it, it's kind of ridiculous, because it's like, okay, formula or breast milk up until one, and then all of a sudden they're on 3 meals a day. Like,
Right?
you're gonna throw your kid on 3 meals a day from just formula or breast milk. So
Mhm.
talk to us about your
Mhm.
philosophy with all of that.
Okay, so glad you brought this up. Biggest pet peeve of mine. And I want to first clarify that it doesn't mean that it's not fun starting solids. It doesn't mean that it should be stressful or that it shouldn't be positive experiences. Of course, it should be. But when we say it's just for fun, what that does is takes all of the importance away for what solid food does from a nutritional perspective. And then also, again, from the perspective of learning how to eat and develop those skills. If you think about, again, let's forget the 6 to 9 months. Let's just say 6 months to 12 months. Your baby needs iron. It needs to have that from a supplemental source, meaning outside of breast milk and formula, and needs it through food. Your baby's iron stores are basically starting to deplete right around 6 months of age. You have time. It's not like the moment they turn 6 months, we have to pump all this iron into them, but they need that time over the next few weeks to learn, again, how do I eat? How do I swallow this? How do I chew this? How do I enjoy this taste of meat puree and meat finger food, whatever it is, or beans or tofu? How do I get that in enough quantity so that I can swallow it, consume it, and get enough iron in? Because their iron needs are so high, and you can only get that need met through additional iron coming from food. um, the other thing is that, again, introducing allergens. We know from the research now very clearly that we actually want to introduce allergens early in the starting solids process, and often. So for most babies, right at around 6 months of age, that's when we would introduce it, when you introduce most solids. If you have a baby who is at high risk for developing an allergy, so if there is anybody in the immediate family with an allergy, or if your baby has severe eczema, then you actually might want to introduce just the allergens in small and safe ways earlier, starting at 4 months of age, just those, not all solids. So, what that does is reduce the risk of developing an allergy later on in life. So, the longer we delay it, and knowing that there's 10 major allergens to go through, and that's just if you lump all tree nuts together. Tree nuts is one category, but technically you should be introducing the individual tree nuts separately. So cashews and almonds and walnuts and all of those. So that takes time. And again, we want to try and do that earlier. If you're going to wait till closer to 1 month or 1 year, when you really start branching out and giving them all these allergens and stuff, well, you're going to miss that opportunity. Um, Again, learning to develop the oral motor skills. We need to do that early. The longer we wait past 9 months of age, the harder it is for your baby to learn how to chew foods, how to manipulate foods with their tongue, how to coordinate their swallows well, how to use their jaw effectively. All of those are better suited earlier on. And again, what we talked about with the gag reflex. So if you're not going to take solids seriously, let's say I might offer solids once every couple days if I feel like it or if I had the time, because it's a big commitment. I know it's very hard time wise. You have to throw this extra thing in the middle of your day. You've got to prep food. It is hard, but it's easy if you were to think food before one is just for fun to just skip multiple days. Or again, maybe you're only offering really easy textures. Maybe you're only offering the same simple easy foods. Oh, I've got a banana here, I'll just offer that. Oh, I've got the avocado, I'll offer that. But I'm not exposing them to the variety. So I just want parents to understand that it is fun, it is positive, but it's not just for that. There's a huge importance to focusing on solids earlier on and not letting it go, till closer to 1 year to take it really seriously. And I know you had asked the question before and I forgot to answer it. When do you want to start introducing more meals and when do you need to be on 3 meals a day? So when you first start, 1 meal a day between 6 and 7 months of age, just get into the groove of it. You and your baby, ease yourself in. No need to rush to 2 meals. You could, but we don't want breast milk or formula intake to go down at that point, right? So they should be drinking the same amount of breast milk or formula. Once they hit closer to like 7, 8 months of age, that's when you can add your second meal. Again, there's an importance to this more than just like, oh, they could handle more or we want them to eat more. It's another opportunity to develop those skills, develop the exposure, and make things happen quicker within 6 to 9 months. And then once they hit 9 months of age, that's when you want to add the third meal. So doesn't matter whether you start with purees or finger foods, by 9 months of age, they really should be on 3 meals a day, and they should all be in the same spot in terms of their abilities to eat a variety of finger foods and purees and flavors and textures and all that stuff is there. So you would have no idea how they started by 9 months of age. They should all really be in about the same place.
That makes sense. So, what do you do with parents with kids who are maybe a little bit older? Maybe they're like 10, 11, closer to that year, and they're kind of stuck, right? Like maybe they're stuck on a certain texture because of fear, because of, giving them something that's a little bit harder, a little bit more challenging, or what happens with those parents who maybe they didn't find your account until their kid was a year and all
Mhm,
they've given them was purees. Like, is it too late for
mhm,
them, or like
mhm.
how do they start from that point? Because I could imagine feeling pretty defeated if I'm a parent listening to this episode, my kid's 12 or 13 months, and I'm like, oh shit, like they haven't had anything but pureed food. Like, where do they start?
Yeah. Okay. Great. I'm like just super happy you are saying that because I don't want parents to feel like they can never fix things or that things are horrible or ruined or, I've ruined my child, I've missed my chances. Absolutely not. It's just easier, to do it earlier. So if you're at the point where your child's 11, 12, 13, 14, 15 months of age, and you feel like they haven't got that experience or they're really, really picky, they just don't like a lot of different foods. Like you said, maybe they have some anxiety. The first thing I like to do is, first of all, make sure that they are being offered meals and snacks frequently and on the right schedule. Because oftentimes, I would say 90% I'll say 85% of the time for the clients that I see, there's a lack of appetite and interest because there's an over reliance on milk. Again, because they never really got developed that love for solids. So they're growing, but they're getting those calories and nutrients still from milk. And they don't have enough of that incentive and appetite to dive into more solids if there's a lot of that milk. So I like to cap milk at 16 ounces a day by 1 year and make sure things are spaced out. So I always look at the schedule and if they're spaced out appropriately so that they have truly and develop that opportunity to have some hunger and motivation, then that's a place to start. After that, we want to encourage play and in exploring food with their hands with all five senses. So smelling it, licking it. Of course, some kids don't want to put it in their mouth though. So maybe it's okay, let's squish this between our fingers. Let's paint with this puree. Let's dip this thing in and just dip it. You don't have to eat it at this point. Modeling eating those foods, and then probably the biggest thing is not offering a backup. So what I always like to say is you would have a safe food at every meal, which is something that your child can reasonably eat if they're hungry. So going back to what I said, where at this point they need more calories from solids, like it's almost they have to rely on it. So you don't want them necessarily skipping all their meals. It's normal for them to skip 1 meal a day. That's pretty normal and healthy. It's okay. They'll usually make up their calories in other meals. But we don't want them to be hungry and stressed out and I have nothing to eat. So we give them a safe food which doesn't have to be a favorite. That can be a trap. Sometimes we think, oh my God, okay, well, they love their vanilla Greek yogurt. That's what they're going to have as their safe food. But if it's too much of a favorite, they're going to forego the other option. So we kind of find something they've accepted within the last month. Okay, that's a safe food. They could reasonably eat that if they were hungry. Then we have new foods or new variations of food showing up as much as possible. So I always look, I always do like a 3-day food diary for any of my clients, and I'll look at what's being served, how's it being served, what's the timing, all that stuff. And what I typically notice is most variety is happening at dinner, whereas breakfast is like maybe the same meal every day. Maybe every 2 days you switch it up. Or even when you switch it up, it's the same version. So it's always like oatmeal and blueberries, and then it's yogurt and bananas, and then it's oatmeal and blueberries or oatmeal and raspberries. But they never see like a true variation. They don't get like hemp seeds and peanut butter, and they don't get this and that, and maybe some ground almonds, like lots of varieties that you could add into those that make it look different and make them feel A, I get more exposure. So they're practicing, but B, meals are supposed to look different. So I'm not going to fight it as they build up like that tolerance to sometimes it looks like this, sometimes it looks like that. They're going to fight less. They're not going to be so upset when they see something that's like, it's not yellow cheese, it's white cheese. Oh my God, this is, I can't handle this and I'm going to throw a tantrum or I'm going to be so anxious. You kind of build them up step by step in conjunction with play and curiosity, positive experiences at the table and away from the table with food.
That makes a lot of sense. I think we could talk a whole nother hour about toddler feeding, right?
100%.
And because I feel like after, I don't know, at least for me, my experience with her, like after 12 months, is like a lot of our feeding issues, I think, are like developmental. It's not like her being picky, it's her being a toddler,
Yeah.
and
Mhm.
like trying to push boundaries and stuff like that. So yeah, what do you do? I guess there's so many questions I could ask in terms of like 12 months plus because that's where I'm at right now currently. But when kids don't want to eat, like you serve a food and they don't want to eat it. Like they're
Mm,
my daughter does the smearing thing sometimes,
mm,
or she starts to throw food. Um I don't keep offering her food until she eats
mhm.
it. That's the meal. And
Per
if she doesn't want it, she doesn't want it. So
perfect.
that's how I do it. But like, what do you say to parents who are? I don't get freaked out that she's not eating. There's a reason
Good.
why she's not eating, right? So talk a
Yes.
little bit about that in terms of development and toddler feeding.
Yeah. Okay. So, what I think is the most helpful thought to have, especially if you're in the babies phase and you're transitioning into toddlerhood, is which, by the way, in the feeding world starts around 10 months of age. So, it happens really early where you see
Hmm.
these changes happen, is know what to expect. And, like you said, what's developmentally appropriate. So it's developmentally appropriate for a baby to generally consume the same number of ounces, the same amount of solids, pretty much every meal or every feeding opportunity. And they're on a pretty general schedule. Yeah, you'll have your off days. Maybe they're a bit sick. Maybe they're, cranky. Maybe they're teething. But for the most part, that's how they operate. And they grow a lot, right? They're growing. Obviously, their main job is to grow within that first year of life for survival. Once they approach toddlerhood, all priorities shift. Okay. So your child is now no longer prioritizing calories, just developmentally, evolutionarily. So you actually can start to expect a little bit of a either decrease in appetite or fluctuation. So you may see some meals they eat a lot. Some meals they eat nothing, like literally air. The next one they might take 4 bites. And so knowing that they will make up calories. So all you need to do is kind of focus on your job. So think about I'm going to serve meals at regular times, right? I'm choosing the schedule. Um, I'm also going to choose what is going out there. So I'm kind of paying attention to what meals or what foods do they need to be exposed to? What do we have in the house? What's on sale? What's healthy for them? I'm choosing the menu. That's the parent's job. And then where meals are served. So ideally it's at the table, but generally speaking, it's just you have that control so that your child's not running around and eating while they're playing or distracted or um, you know, whatever it might be. So you choose those 3 things and you're setting up that right environment also by choosing where. Then you have to pass the buck. You have to give all that control to your child and trust them just like you did when they were babies and they were breastfeeding and they knew from the moment they got out of the womb, I know when I'm full, I will unlatch and I will stop. And when I'm hungry, I'm going to cry and I want food, right? So at this age, it's the same thing. Ideally, we've kept that going and now they still know I'm not hungry. I'm gonna, mom presented this amazing meal and you could have chosen the meal perfectly. You could have had the right schedule and you could have them at the perfect setting at the table, but they don't want to eat. The best thing is to give them that, to trust them and say, okay, you don't have to eat, sweetie. Try and keep them at the table, just get them used to still being there at least for 5, 10 minutes. But at the end of the day, there's no pressure. Once we start either thinking something's wrong, oh my God, there's no calories, they're going to starve. How are they going to last? What if they don't eat next meal? Once you start thinking like that, you're going to basically start doing things that counteract good eating habits. And you're going to almost not necessarily drive them into picky eating, but just if they have picky eating behavior, it can be exacerbated. So that's when you might start pressuring, hounding them to eat more, not letting them leave the table until they've eaten a certain number of bites, catering to them and offering them something different, giving them a snack half an hour later, even though you chose a feeding schedule and they decided not to eat within that meal. So if you know ahead of time, this is normal, this is how it's supposed to be, pretty much most kids will skip a meal or a snack a day. Very normal. We're just offering multiple opportunities for food, but that doesn't mean they need everyone. And let them work it out in between. Some days they eat tons. Next 2 days they eat barely anything. Then they have 3 portions the day after. Look at it over the span of a week. Zoom out, trust your child, and keep your roles, and their role. And trust me, that's the best way to approach feeding in this age. And like you said, ride out the developmental kind of changes that they go through, but know that nothing is being made worse by trying to change things.
Yeah, I love that. That's why as soon as we were pretty much, I think when she was like 10 months is that's when I did the toddler course because I'm like, okay,
Mhm.
shit's changing already.
Yeah.
I gotta see what's up. But yeah, no. So where can my audience find you?
So the best place is probably Instagram. My Little Eater is our handle. We post daily on there. Videos and tips and all the jazzes. Everything you need is there. You can also send us a DM if you have any questions. Our website, mylittleeater.com, it has a new blog that goes out every single week. So it's tons of free content. You can search things on there. Likely, if you have a question, the answer is in one of our blogs because we have so many. And you can also email us if you have anything personal or you have any, more individual questions at info@mylittleeater.com.
So besides the courses, I know you have the baby-led feeding course and the toddler course. Do you do personalized support for people as well, or just the courses at this time?
We do.
Okay.
So I have a dietitian that works alongside of me. We have, we each take our own clients. I will say that for Canadian clients, it's a lot easier just because it's covered under our insurance plans,
Okay.
most of them. But we do see, clients from all around the world. So if you are interested, we could always set up a free discovery call, chat about your situation, explain how counseling works, and then you can work one on one with one of us. And just know that, you're not going to get general tips. It's going to be very specific to your situation.
Yeah, yeah,
Mm.
absolutely. Well, I appreciate you so much for being here. Like I said, we could do a whole nother episode on toddlers because it's so different. But um, please go check out Edwena's content at My Little Eater on Instagram. Edwena, thank you so much for being here.
Thanks so much for having me.